Hello, my name is Vanessa, and I'm a registered nurse working at Shriners Children's in a pediatric specialty hospital setting. I currently work as a pediatric burn nurse caring for children with complex burn injuries and other specialty healthcare needs. In my role, I complete patient assessments, provide wound care, administer medications, manage pain, educate families, collaborate with healthcare team, and document patient care throughout my shifts. Because pediatric burn patients often require frequent assessments, wound care treatments, and close monitoring, nursing workflow can be complex and time insensitive. For this video, I will be discussing how artificial intelligence, or AI, could be used in my workplace to streamline nursing activities by improving documentation processes, reducing repetitive tasks, and supporting safe clinical decision making. One area in my workplace that can be challenging is nursing documentation. Pediatric burn patients do require detailed documentation related to wound assessments, dressing changes, pain management, patient responses, skin integrity, mobility, nutrition, and family education. Documentation is an important part of safe patient care just because it supports communication between the healthcare team members and helps maintain continuity of care. However, completing detailed documentation can also be time consuming and add on to the workload that us as nurses already manage. Tani et al. Examined electronic health record usage in a tertiary pediatric burns clinic and identified opportunities to improve documentation workflow and usability. Their findings demonstrate that the way documentation systems are designed can influence how efficiently healthcare professionals complete their work. Now, in my own practice, documentation is necessary, of course, but improving these processes could allow nurses to spend more time focusing on direct patient care and supporting families. Another challenge related to documentation is the amount of time nurses spend navigating electronic health record systems. Nurses must balance charting responsibilities with patient care, assessments, communication with families, and collaboration with the healthcare team. Nurses have identified that electronic documentation systems can include repetitive steps and areas where workflow can be improved. These concerns are important because inefficient documentation processes can increase workload demands and contribute to frustration during a shift. In a specialty setting such as pediatric burn care, finding ways to reduce unnecessary documentation burden could help nurses focus more attention on direct patient needs. One way that AI could help address this challenge is through AI assisted documentation tools. These tools could help organize information and reduce some of the repetitive steps involved in documenting patient care. For example, after completing a wound assessment, an AI documentation assistant could help create a structured draft that includes assessment findings, interventions performed, and patient responses. The nurse would, of course, still be responsible for reviewing the information, making corrections needed, and confirming that the documentation accurately reflects the patient's condition. Perkins et al. Identified that artificial intelligence has applications in improving clinical documentation processes by supporting efficiency and reducing documentation burden. However, they also did emphasize that healthcare professionals must continue reviewing and validating documentation to maintain accuracy and safe practice. In this situation, AI would not replace nursing judgment, of course, but instead it would serve as a support tool that reduces the repetitive administrative tasks and allows nurses to spend more time providing the direct patient care. AI could also support these nurse leaders through tools such as predictive analytics. Now, predictive analytics uses data patterns to help identify trends related to the patient needs, the workload, and resource planning. For example, nurse managers could use the AI supported information to better understand changes in the patient's workload and identify when additional resources or the support may be needed. However, AI will still need to be combined with nursing experience and the professional judgment when making these decisions. AI applications in nursing have been explored as a way to support workflow improvement, clinical decision making, and nursing practice. Ruska Kulpait also discussed that successful AI implementation requires staff education, appropriate planning, and consideration of ethical concerns. There are several possible benefits of incorporating AI into the nursing practice. AI assisted documentation could help decrease the repetitive charting tasks, improve the workflow efficiency, and allow us nurses to spend more time providing direct patient care and supporting families. AI may also help organize information and support clinical decision making when used appropriately. Research on AI supportive documentation has identified opportunities for improving efficiency while maintaining the importance of clinical oversight. However, there are also important considerations before implementing AI technology. These healthcare organizations would need to consider the cost of the implementation, the staff training needs, the privacy concerns, ethical considerations, and of course, the possible resistance to changes in workflow. These factors are all important because AI should be implemented in a way that supports the nurses and improves practice rather than creating the additional barriers. As I continue developing as a nurse leader, I think it is important to understand how technology can support nursing practice while still maintaining the human connection that is important to patient care. If AI were introduced into my workplace, my role as a nurse leader would include helping evaluate whether that technology improves the workflow, supports our staff, and contributes to the safe patient care. The nurse leaders would also play an important role in helping staff adapt to the new technology by providing education and ensuring the AI tools are being used appropriately within the nursing practice. One thing I would like to learn more about is how healthcare organizations measure the impact of AI after the implementation, specifically whether these tools actually reduce the workload, improve efficiency, and positively influence the nursing practice. Overall, AI could be a valuable tool in pediatric burn nursing by improving documentation processes, reducing repetitive tasks, and allowing nurses to continue providing safe, compassionate, and individualized care. Thank you.